A growing number of doctors and medical societies have avoided using it as a diagnosis, stating that it has no scientific or medical validity. In addition, the term has often been used to describe the deaths of men and women of different races, adding a racial element to controversial diagnosis. From the beginning, this terminology has been disproportionately applied to communities of color and has only been used in specific contexts related to encounters with law enforcement, Gipson added. California Governor Gavin Newsom signed the bill into law on Sunday, October 8. What is excited delirium? Excitable delirium is a vaguely defined term that describes symptoms such as aggressive behavior, high tolerance for pain, extreme agitation, and emotional distress. The diagnosis emerged in death certificates, police records and coroners' reports during the crack cocaine epidemic of the 1980s. According to a report by Physicians for Human Rights, the term soon became used as a general term for deaths that occurred in the context of law enforcement restrictions and often coincided with substance abuse or mental illness. By 2009, the American College of Emergency Physicians recognized excited delirium as a legitimate cause of death. The Physicians for Human Rights report also noted that the term was adopted in police training manuals and introduced at conferences of medical doctors and police chiefs. Is excited delirium real? Despite endorsements and widespread use, excited delirium has never been recognized by psychiatrists or other mental health professionals. Excited delirium is not a reliable, independent medical or psychiatric diagnosis, Gipson said. There is no diagnostic manual and it is not recognized in the DSM-5, the main diagnostic manual for mental health providers, he added. Neither the American Medical Association nor the American Psychiatric Association recognizes this term as a legitimate diagnosis. In fact, the AMA have never recognized excited delirium as a true syndrome, and critics have repeatedly stated that it is unscientific, rooted in racism. In this, a Rochester, New York, police officer is seen placing a hood on Daniel Prude's head. Prude after police held him down and he subsequently stopped breathing. Misuse of the term D. Chairman of the Department of Pathology at Howard University in Washington, D.C. Excited delirium is often used when death is involved due to a physical fight between a citizen and law enforcement, Roger A. Mitchell Jr. told the Associated Press. In recent years, the term has emerged as an explanation for the killings of blacks, Latinos and other people by white police officers. In 2021, excited delirium was cited in the death of Daniel Prude, a 41-year-old black man in Rochester, New York. A grand jury dismissed charges against the police officers in this case. Excited delirium came up again in the 2021 trial of former Minneapolis police officer Derek Chauvin, who was later found guilty in the death